All right, let's dive right in. Today, we're talking about a medication that deals with a feeling that, let's be honest, is just awful. That disorienting, spinning sensation when the world just refuses to hold still. We are talking about Cinnarizine.
So, let's start right there with that feeling. It's so distinct, so unpleasant, and a lot more common than you might think.
You know what I'm talking about, right? Whether it's from a choppy ferry ride, a long winding road trip, or maybe just a dizzy spell that hits you out of the blue. That feeling of vertigo, of motion sickness, it's a clear signal that your body's internal balance system is completely out of whack.
And that's exactly where Cinnarizine comes into the picture. It's a medication designed to get right to the root of that spinning sensation. And it does it by targeting the two key players, the balance system in your inner ear and the blood flow that keeps it all running smoothly. So how in the world does it actually work? This is where it gets really clever, because Cinnarizine isn't just a one-trick pony. It's actually fighting the problem on two different fronts at the very same time.
Think of it like a two-pronged attack. On one hand, it's acting as what's called a calcium channel blocker, which helps relax your blood vessels to get more blood flowing. And on the other hand, it has a powerful antihistamine effect that directly calms down the body's overactive balance centers. Let's break down each of those.
So first, that blood flow. The best way to think about it is like a garden hose that's got a kink in it. Cinnarizine basically unkinks the tiny blood vessels in your brain and inner ear. It does this by stopping calcium from getting into the muscle cells and the vessel walls. When that happens, those little muscles just relax. The vessels open up, they get wider, and boom, blood flow improves. Now, at the very same time, it's making its second move as an antihistamine. It goes into your brain's balance centers and blocks certain signals, basically telling an overexcited system to just take a breath and calm down. This really helps to quiet down all those chaotic messages that are causing the dizziness and nausea in the first place.
Okay, so we've got this cool dual-action drug. What is it actually prescribed for? Let's take a look at how this unique one-two punch is actually put to use. Well, its main jobs fall into two very neat categories that, you guessed it, line up perfectly with its two actions. It tackles problems with balance, and it tackles problems with blood flow.
Its number one job, its main gig, is treating what are called vestibular disorders. This is the go-to for preventing motion sickness before you get on a boat or a plane, or for managing that really intense vertigo that can come with conditions like Meniere's disease. But that's not all it does. Because of that ability to widen blood vessels, it also has a secondary role in helping with certain circulation issues. For example, it can help people who get painful cramps in their legs when they walk because of poor blood flow, a condition called intermittent claudication.
Okay, now for the really important part. Because like any medication that actually works, Cinnarizine has risks. It's absolutely crucial we talk about the warnings and side effects. So let's shift gears and give this the attention it deserves.
The side effects kind of fall into two buckets. You've got the common stuff you might expect from an antihistamine, right? Drowsiness, feeling tired, dry mouth. But then there's the less common but much more serious bucket. These are called extrapyramidal symptoms, and they affect your movement. We're talking tremors, muscle stiffness, slowed movements. And this is a real risk for older people, especially if they use it long term.
And I really have to hammer this point home. The number one side effect is drowsiness. This is not a might feel a little tired thing. It can be serious. You absolutely must not drive or operate any kind of machinery until you know exactly how this medication hits you personally. Seriously.
Then there are a few absolute no-go situations. Because it can mess with the brain chemical dopamine, it is a definite no for anyone with Parkinson's disease. And of course, like any drug, if you have a known allergy, stay away. It's also not recommended if you're pregnant or breastfeeding. And finally, you have to be super careful about mixing it with other things. If you combine Cinnarizine with anything else that slows down your central nervous system, think alcohol, sleeping pills, even some other antihistamines, you can ramp up that drowsiness to a really dangerous level.
So, let's pull all this together. When you step back and look at the whole picture, Cinnarizine is, well, it's a real balancing act, in more ways than one.
And here's a surprising little twist. While this drug is a go-to cornerstone treatment for vertigo in places like Europe and Asia, it is not actually approved by the FDA for use in the United States. It's a fascinating look at how different parts of the world can approach the same medical problem so differently.
You know, the source material really sums it all up perfectly here. The drug's unique power comes from that amazing dual action, no doubt. But
those benefits always have to be carefully weighed against the very real risks, especially the sedation and those potential movement disorders.
And that really leaves us with a big question, doesn't it? Cinnarizine is, without a doubt, a very effective tool for getting your balance back when the world decides to start spinning. But for each and every person in each and every situation, you have to ask, is that trade-off worth it?